So, what brought you to see me?
Well, it was around November of 2024 when I started to feel a lump in my left breast. I don't even know how exactly I found you, but I was looking for a functional medicine practitioner because I don't trust really any of this pharmaceutical, industrial, medical, money making protocol. And let's just say that God led me to you because
That's fine.
the first appointment we had was around
It was May, March.
April, May, yeah, March.
March. I knew it was an M word.
Of 25.
Last year.
And you sent me to have a thermography, which was right up my alley because I didn't want to do all the,
Yeah.
what's the other scans they do?
Oh, the PET scans.
The PET
and
scans and
all that.
Radiation. So that threw up the first red flags is you need to go.
See a doctor.
Yes.
Yeah.
You need a
And
higher authority.
They referred you to a physician to do an ultrasound, right?
They referred me to a physician.
Physician, yeah.
So I think I saw her in July.
I think that's
it took me a
correct.
while because she was semi-retired. She was that was like one of her last appointments.
Yeah.
And at the end of our 2-hour discussion and this and that, she looked at me and said, well, why are you here? And I said, well, I want to know about this lump in my breast. And she laid me down on her table, manipulated it a little, sat up, looked me straight in the eye and said, you have breast cancer. And I said, that's impossible. I'm a healthy girl from California and, I take care of myself and, I'm still talking a million miles an hour. And I just said, how could this have possibly happened to me?
Yeah.
And she said, because you're fat. And that shut me up. I was like, I got kicked in the stomach. How could, she's a physician now.
And just called you fat.
And how could she say that right to my family? So then she kind of tried to, say, oh, well, adipose tissue can lead. I wasn't listening by that point. I had to leave. But she did get me a referral to Vanderbilt.
Okay.
So I eventually got into the system, mainly because my husband wanted me to.
Okay.
So from that point till around September.
Mm-hmm.
Is when I tried to do what they asked me to do. I did the scans and I did the
biopsy.
The biopsy was in September and it was a disaster.
Mm-hmm.
They mangled my breast.
Mm-hmm.
It took me a month to recover just from the biopsy. And I hadn't done a mammogram in a long time. I hadn't seen a doctor in a long, long time. But this kind of confirmed the fact of why I didn't see a doctor is it just did not go well.
Yeah.
So by the time I ran out of there in tears, they set me up for the surgery. They were going to do a lumpectomy.
Mm-hmm.
So I continued, and the day before I went for the pre-op, the oncologist called and said, oh, we found that it spread, which it went from a stage 2 to a stage 4, like overnight.
Which it didn't happen overnight, but they just didn't know the extent of it yet.
They didn't know, and they were on the fast track to the moneymaker, which is the surgery and the chemo. So I had made it clear to them that I'm not doing chemo.
Mm-hmm.
I'm not killing all my cells.
Mm-hmm.
There's got to be another way. And, I've lived this healthy lifestyle. What is going on? That all of a sudden things have gone this wrong with this one thing.
Yeah.
And anyway, help me if I get off track here. But
You're doing great.
Yeah. So I ended up not doing the surgery at the last minute. After she told me that, I was kind of relieved. I was like, good. I didn't.
You didn't want to do it anyway.
I didn't want to do this in the first place. So that was kind of good news to me.
Yeah.
And that's when I went home and I told my husband, I went as far as I can go with these people, and now I'm going to this lady who can help me. And that's when I think
when you reached out. It was October.
It was October.
Yeah.
Of 2025.
Last year.
So
it's been 6 months? October, November, December, January, February, March, April, May. We're in June. It's been 8 months.
Yes. So between October and, let's say, you gave me the protocol of what I could do, but I was so overwhelmed at that point, and there were other things obviously going on. I just wasn't ready to jump
in, but you did the best you could, because we're not, everybody gets like this big protocol of things to do, and so it's like, just do what you can do, and as you get comfortable with that, increase it, and that's how we worked forward, right? Okay.
So just getting a grip.
And you were dealing with the loss of your health, which is grief.
Yes.
And people don't think about that, but that is grief. You're grieving who you were.
Yeah.
And so there was a lot of emotional stuff going on as well as the overwhelm.
I was just completely disconnected.
Yeah.
Disconnected from myself, my health, my body. I had spent my whole life giving. I have a theory that nice people get cancer because we're always giving and doing and, putting on this facade of we're fine,
and putting our own health and our own self-care on the back burner.
Right.
Yeah.
So it was good because you saw me as the whole person. You didn't just see me as, the dollar signs chinking in your eyes that I...
But I wasn't cheap.
No. But you're worth it.
Okay.
No, but you're the first person to connect what's going on my insides with what was manifesting
in the cancer.
Yeah. Because I had never put those two and two together at all before. I mean, I just thought it was some random thing. Oh, and every quote doctor I talked to, I said, well, why did this happen? How can you treat something if you don't know what caused it? That was my point. What causes this cancer?
Yeah.
And you're the only one who put the two and two together of what is causing this is your immune system, which is in your gut.
Yeah, it's in your gut. That's a start.
Okay, yeah, that's a start.
And you had a lot of stress because you're running a business. You're married. You've got dogs. You've got a son. You've got houses in other states. You're trying to manage. You have a lot that's going on too, and stress directly affects your gut, which then in turn directly affects your immune system.
Yes, and what I'm just realizing now, 6 months later, is I've been that way my entire whole life.
Yeah.
I have lived on the parasympathetic versus
sympathetic
nervous system.
Yeah.
Is, I'm the A-type personality who, if I needed to get my taxes done, they were getting done on, the day before they're due. Just all the things. I was living on that level for decades.
Wow.
So this just did not happen overnight.
No, it did not.
This, in California, you were moving 1,000,000 miles an hour, and when I moved here, I had to go, things are different. People just...
Yeah, in the South, we're a lot different.
Yeah.
But you're living in the South where things are slower, things are different, but you're still working in California.
Right.
So you're still on that Zoom California lifestyle, even though here you don't have, like in your day-to-day, you don't have to do that, but you're doing it at work.
Yes. I mean, I've even had to tell my clients, like, can you please talk more slowly? Because I'm not on that level anymore. I have, and I don't jump when they say do this. I'm like, okay,
Yeah.
I'll get to that tomorrow.
So, do you feel comfortable sharing both the bad and good experiences that you've had in this 6 months you've been working with me? And I want to preface that with the cancer's not gone.
Mm-hmm.
We're still working on that. That's not going to be a quick fix or a quick go away. You know, you had stage 4 cancer and it was everywhere.
Right.
So besides the lump in the breast, but just tell me what's been the good, the bad, and the ugly about working with me, and where you've gone, where are you at from where you came.
Okay, so
start with the good, bad, and the ugly working with me.
Well, the good is you're now like my savior, because
oh my God.
No, I mean,
I'll cut that part out.
No, you literally saved my life. That's what I feel. That's the good part.
Well, it's an honor to walk this journey with you. I'll say that.
No, because no one else, first of all, understood the me, what I wanted to do. Even my husband could. He still can't get the whole grip of it, but all he sees are the results, which is
good.
I'm functionable now. I can get out of bed. I have energy. I can, we've completely changed how we eat, and just my whole thoughts around not just food, but how I approach food as not just, this is really good, I want to go to this restaurant again, is how is this healing my insides? Is this helping me? It just so happens some people can just eat hot dogs and chips like my husband and not have it bother him. I can't do that.
Yeah.
I need the nourishing things that are going to calm my system and heal me from the inside, where that's, I'm still not sure the whole where the cancer came from, but I can tell you that factors that contributed to it: stress, a broken immune system, whatever that means, but now that I've been reading and investigating, this is exactly what I needed to do to help myself.
Yeah.
So that's the good. The bad, I don't even want to call it bad, but it's a difficult protocol.
It's a lot of work.
Yeah. I have to plan, if I'm going to go somewhere, I have to still take my supplements, and I have to do my GI replenish, and I have to, I have to do the things that I have to hydrate, and I just can't say, I used to throw on my clothes in 15 minutes, I'm out of the door. I can't do that anymore, but that's okay. I'm taking care of my health and trying to save my life here.
You showed me a before picture when you first came, and I'll pop that in. You don't have to pick it up. I'll pop it in into the video later. But you were showing your before picture, and today, looking, you came in today. You feel good. You felt good enough to put some nice clothes on. you look beautiful. Your color is back in your face. You're not just inflamed, because the picture that you showed me was just red. You were inflamed. Here I see color. There's a different color than red. And might be a little washed out on the camera, but you came in, you're feeling good. I have energy today, and you've been going and doing. You're planning a trip to Hawaii, and so you're a different person.
No, I'm functional.
What I'm seeing is a different person.
Yes.
That you're functioning, you're sleeping better, you're just overall have more energy.
Yeah,
and we're still fighting cancer.
Yes, but to connect the fact that this level of stress that I thought was normal from a child. I mean, they thought I had trichotillomania. No,
Did you pull your hair out?
I would sit behind the chair in the living room and pull my hair out. I've always been a really nervous,
intense person.
Intense. Yeah, so even as a child, I just thought I was normal. I bit my nails until a few months ago, and now
You're growing nails.
So just, I almost didn't even try. But just the fact that my whole system is getting normal.
Changing to a place that's healthier.
Okay, thanks. Because I thought that was normal to live
Yeah.
like that. It's not normal.
No.
It was killing me.
Yeah.
So, yeah, the difficult thing that's saving my life is what the tools that you've given me on the protocol and the herbal supplements. I thought, what did they used to do in the olden days? You know?
People died of cancer.
But they weren't taking all this. Cancer doesn't kill people. I think it's the treatment of the cancer that kills.
Well, I think it's a combination. Cancer does kill people. Yeah.
Which you can't ask the oncology department at Vandy where does cancer come from? Because the PhD who did my mammogram looked at me through her $800 glasses and said, "It's just bad luck."
Bad luck. Wow.
I don't accept that. You know,
Yeah.
and the rest of them were like, "Well, we don't know. It's just, it's a crapshoot."
Our cells age.
Yes, and I can also say that this exact duct, this milk duct, has always caused me problems from 38 years ago when I was nursing.
Nursed, okay.
So there was something that wasn't right. It was probably inflamed for a long period of time.
Could have been.
Or dormant or whatever. But it just said, "Oh, this is the good place to."
We're just gonna start
congregate
it right here. Yeah.
But the fact that I'm feeling as good as I feel, because honestly, I felt like I was going to die.
You were dying.
I was dying.
Yeah.
I looked like I was dying, and I felt like I couldn't do anything.
Yeah. I remember.
I could barely take care of myself.
Yeah, I remember in the first few months where you were just like, "I can't do this. I can't do this." And we were working together a couple times a week.
Yes.
And you're like, "I can't do this." And I'm like, "Yeah, no, yes, you can. You can do this."
Yes.
And to be fair, you still haven't done everything that I told you to do from the beginning, but you're doing the best that you can, right? And we talked about that. It's like this is a roller coaster. We're going to have good days and bad days. And you said earlier you're having more good days than bad days, which is wonderful.
Yes, it's a miracle.
But there's still bad days sometimes. Sometimes your body says, "Nope, today I need to rest."
Yes.
And you give yourself permission to do that.
I do.
That's huge.
Yeah.
Because you weren't doing that last year.
Right.
And
no, I'll have a down day and I'll just stay down. My husband will pick up the pieces and, he'll take care of himself, and
it's good to have that support too.
Yeah. So.
Yeah. So, is it okay if I share a little bit on the medical side?
Yes.
Okay. So when you came, you had a 12 millimeter lump. There was another one as well, but the largest one was 12 millimeters. And then when you went for your second scan, that had gone down to about 10 millimeters. You'd lost about 2 millimeters on that lump, which is huge in 3 months of not doing the medication. But you went to the doctor and you said, "Well, how come it's shrunk if I'm not doing the medication?" And so can you share that story a little bit?
So I had the appointment after the scan, and the oncologist said, "Well, this is what it is." They look at you like this, like, oh, like,
really sad.
We're sorry you're gonna die. And I said, "But the lump has shrunken. I don't know.
Gotten smaller.
What do you attribute that to?" And she said, "Oh, it must be the medication that we gave you. They gave me letrozole."
Which was to stop your body, the estrogen from feeding the cancer. That's what that was for.
I took one pill
one time
in October, and this was January. I threw the rest of the bottle away because it made me so sick.
Yeah.
But she said, "Oh, the reason it shrunk is I took that one pill
The one pill
of
shrunk it. So
Okay.
now we're waiting 6 months, right? And you've got a scan in July,
Yes.
hopefully. And we're gonna compare again.
Yeah.
Okay.
But I mean, of course, that's the first thing I do in the morning is feel it,
Mm-hmm.
and what's happening with it, and it's definitely smaller. I'm almost looking forward to the scan
To the scan.
because
Wow.
not only am I feeling better, but I'm also feeling that the lump is smaller.
Yeah.
I don't know if it's ever going to go away totally, or I really don't know what's going to happen.
The ultimate
But-
goal would be that it goes away, but again, it's cancer, and we don't know.
Right.
There's no guarantees, but then we have a life, and there's no guarantees in life, and that's kind of something else that we worked on. Was understanding that we all have the same ending. We're all going to die,
Right.
and being okay with that.
I wasn't okay with it
I know
because
you weren't.
I was 66 when
Yeah.
that went
Yeah.
down. I'm going to be 68.
Yeah.
And I thought, that's,
Too
I don't
young.
want to, I thought all my relatives lived till their 90s.
And you just might too.
Yeah. So, but I thought that doesn't make any sense. This,
Mhm.
It just wasn't, for someone who thought they lived a healthy lifestyle, I didn't factor in the stress of what that really does to your body.
Yeah.
So, and it's hard to go from that
Yeah.
being stressful all the time to, I don't care. I say that a lot during the day. I don't care.
I don't care. Let it go.
Yeah, it's gone.
Yeah.
I'm not cleaning the baseboards anymore, so
And it's okay.
yeah, it's okay.
I mean, dust is a protective coating for our furniture here in the
Exactly.
South, right?
Yeah. It'll get done, or it might not.
It
It's
may
okay.
not. That's what we used to use the kids for. You're bored? Oh, let me get the let me get the dusting stuff. You can go clean the baseboards. Yeah. So, if you were to tell people your experience and have words of wisdom for them, or something that stands out for you, or both, what would you say? What would you tell them about your experience?
I would say it's not your fault.
Mm-hmm.
It's kind of just how you're wired. And I would also say give it to God. Because God led me to you. That's all there is to it. In California, they'd find a lot of people like you, but here in the middle of nowhere, Tennessee, Alabama, it's rare to find a person who's going to speak my language and, go this direction with this serious, life-threatening thing. And people think I'm crazy, but,
Yeah. What would you share with them about the experience you've had with me?
The tools that you use are extremely effective. You, as the human part, you get what I'm talking about. Like, you listen, you respond, you tell me the truth, which a lot of people don't like to hear. But you can dig through all the stuff that we cover ourselves up with, and get to the point of what's going on.
Okay.
So it's hard because the medical industry doesn't really see the person.
Mm-hmm.
They're just seeing money. And it's the same with any business. In my business,
I look at money too. I have to pay bills.
no, but same with my clients. I try not to see them as money,
Right.
but that's how I make my living. So it's hard to, I'm a service person.
Mm-hmm.
That's how I see you. You are serving your patients,
my clients.
with your
yeah.
clients, not just like, oh, this is, this is going to make money
Money.
for you.
Yeah.
You can tell, I'm sorry, but the medical industry is seeing the money.
Yeah.
And they literally got excited when I had my mammogram over there. That people just jammed into the room, hugging me, saying, "Oh, we're so sorry," but they were like excited that they had
Another client, another patient.
That's how I.
That's
felt.
how you felt.
That's how
Yeah.
I felt. It was not a good experience, but you see me as the whole person, not just
The lump in your breast.
the lump in my breast.
Yeah.
And you're treating the whole of the person, my emotions, my problems, my eating, my supplements, all the things that were missing was the me taking care of me.
Mm.
I took care of everybody. That was how I identified.
Yeah.
I identified as the caregiver.
Yeah.
In fact, I told that doctor when she said I was fat. I said, this couldn't be happening to me. I'm the caregiver. People don't take care of me. I take care of other people.
Mm-hmm.
So that was a big, huge thing.
That was a huge thing. Yeah.
Did I answer your question?
Sure. I'm not sure, but
sure.
I
love you.
I know you do. Anything else you want to say before we close this out?
I just encourage whoever is watching this that it's not a death sentence. It's how to live your life the most healthfully you can. And it's self-care. I want to say people in our generation don't know how to do that so well.
Our generation, women were caring for everyone else.
Yes.
Yeah.
So to flip
huge
that
thing.
and say, okay, this is me time. It's the summer of me. It's okay to put you first, and that's the priority.
And I think a lot of people think that's, she's so selfish, she's just taking care of herself. But if we don't take care of ourselves, we're no earthly good for anybody else.
Yes.
So we have to do that.
Yeah. So all the things that you say to other people, now you can say to yourself.
Yeah.
It's okay.
Put yourself in their chair.
Yeah.
All right. Well, this was great to talk to
Thank you.
Thank you for being willing to share your experience so far. Hopefully we'll be able to do this again in a little while longer and say, hey, it's gone.
Yes.
And we're hoping for that. If we could just increase the...
Okay, Mom. No.
But you're doing great, and so I'm so glad to have you share today.
Thank you.
All right.
I love you.
I love you too.